Liberia suffered 15 years of war. We have one of the worst doctor shortages in the world. 51 doctors after the conflict to serve 4 million people. Geographically, it's a challenge. Liberia has one of West Africa's largest rainforests. The tyranny of distance is what we talk about, that if you're too far away, you're the last to receive health services, but you're the one that often needs it the most. At Last Mile Health, our vision is to bring healthcare within reach of every last child and family, while keeping fundamental what matters most, the end aim of saving lives in remote rural communities. In Liberia's National Community Health Assistant Program, which Last Mile Health's working to support the government on, along with a host of other partners, the goals are clear. It's to train, equip, pay, supervise community health workers to deliver health care for 1.2 million people. The training that these folks receive covers everything from tracking the next Ebola, the next disease outbreak, to treating children for malaria, diarrhea, pneumonia, and malnutrition, 4 of the most devastating diseases that contribute to child mortality. That worker then is equipped with a backpack full of the medicines and the gloves and the treatments and the diagnostic equipments, even the smartphone that they need to record the data and assess whether they have the right amount of stock. Co-Impact is now working with us and with our partners at the Liberian government to invest in a long-term community health system that improves primary health care in rural areas.
Different organizations such as Last Mile Health have been providing this service to rural areas for some time. In July 2016, they came together with partners like the Global Fund under the leadership of the Liberian government to create one integrated community health system, which is already 70% scaled across the country. This new partnership will build capacity and accountability across the system, from remote community clinics to policymakers and international funders.
It's more than the capital, it's thinking about how to take the initial investments that they and others have made in this effort in Liberia to bring healthcare within reach of every last child and family, and how to institutionalize and make that last through creating really national-scale government reform and ensure that the government continues to have more and more ownership and ability to manage the program over time. We're 70% of the way in Liberia to reaching every last child and family in rural areas with primary health care. The Co-Impact grant will help us get to 100%, to go from supporting 3,000 workers to over 4,000 and serving hundreds of thousands more people.
So the only time you're going to give it is in the evening time.
The second thing it will do is to ensure that the systems can be sustained, so the skills, the supervision, the supply chain, the salaries gets funded. And the third is financial sustainability, and that when the philanthropy funding is lowered or removed, that the program can still be sustained and led by the government.
The partnership between Co-Impact, Last Mile Health, and the Global Fund is a truly unique collaboration. We have innovative philanthropic model that Co-Impact is bringing. We have Last Mile Health, an implementer bringing both local insight and technical expertise, and then the Global Fund, which brings scale and linkage to the overall government health agenda. That combination, I think, is a very powerful combination.
What happened to your eye? Was painful?
What we're hoping to see with this work in Liberia is that we can establish a proof point or a blueprint that other national governments can take on and adopt, so that we're not just impacting one country, but that then there's demonstration of how others can adopt and replicate and make it their own.
Sometimes When I call my family home, they say, what are you doing in that bush? Why you not working? Because I love taking care of children. I love my community and my community love me.
One of the hopes I have for the future is that through the trust that gets built, the ideas that get exchanged, the perspectives that get learned by people coming together, that we can all get better at figuring how to take on some of the most complex challenges we have in humanity.
All right? Good.
In those relationships that have been tested, have gone through hardship, come through things like the Ebola epidemic, have learned resilience. That's where the deeper ideas come from, where dreams can be hatched and then executed on.